Um, Thank you, Lutronic, and thank you, SkinMD, for inviting me to share my experience today with the LASEMD. It's an honor to be able to speak amongst experts like Prof. Kim and Dr. Cho. So with my profile, at first when they put up my bio, the first thing they said was that I'm the founder of SOSD. Then I told them I don't think that's right because this is not the Dog or Animal Welfare Symposium. But unfortunately, all over the world, people know me more for my animal welfare work than my medical work sometimes. I opened my clinic just 1 year ago because I spent the last 5 years of my life concentrating on animal charity. So last year I decided that it's time for me to concentrate on my career more. And I've had the great opportunity to work with several Lutronic machines. So with the opening of my practice last year, exactly a year ago, I've worked with the Echo Laser, Spectra, and also, of course, the LASEMD. So the LASEMD is a very, very special platform, and a lot of people ask why you get the LASEMD. And actually, before I came in, a few of my colleagues also asked, why do you get the LASEMD? How do you use the LASEMD? And why is it that you use that? So primarily, I use the LASEMD for pigmentation. And as in Singapore, as in all of Asia, a lot of people are very concerned with pigmentation, right? And in many countries, as Singapore as well as many countries, the pigmentation is often mixed. It's very difficult to delineate that it's purely melasma, purely lentigis, or purely horis nevus. It is always a mixed picture, and it's often a horror to treat. Dull skin is a big concern. Everybody wants glowing skin. Every time a person walks into the clinic in Singapore, they will say, I want Korean skin. And then I'll tell them, if you want Korean skin, you have to follow the treatment regimes. So previously, before I used the LASEMD, before I used the Lutronic machines, I used to treat a fair bit of pigmentation. Of course, I use machines like the RefLight, the Q-switch NDX. I use the long pulse alexandrite, long pulse NDX, as well as erbium glass resurfacing and thulium resurfacing in the CMB, clear and brilliant laser systems. So I've had some experience with the thulium laser fractional resurfacing before I used the LASEMD, but there are several very important differences between the CMB Premier and the LASEMD system, which I will explain later on. So big challenges when we treat pigmentation in Singapore. I personally believe that it's more difficult to treat pigmentation in Singapore than in Korea. Correct me if I'm wrong. Simply because of the Singaporean lifestyle. Everybody is so busy, and they often tell us that they cannot even make time to come to the clinic. If they come to the clinic, you make them wait for 10 minutes, and then they scream and say, hey, you waste my time. So we often have to be very, very understanding when we treat our patients. We have to speak their language. A lot of them are too busy to come. So there's a poor commitment to treatment regime. So later, you're going to see a lot of my pictures. A lot of them, I only can present pictures after 2 sessions, after 3 sessions. Why? Because in 1 year, they only can come 2-3 times. And if I tell them to come every 2 weeks, they will say, don't be crazy. That is not possible. I want to come every 6 months. And in that sense, one of the great benefits of the LASEMD system, I feel, is that it gives not only instant results, the results actually last pretty long compared to if you do laser toning alone. So, the other problem with Singaporeans is that they like to doctor hop. They are impatient, and the moment they do one treatment and then they don't see results, they're going to say, this is a poor doctor, I'm going to the next doctor, correct? Right, so they will say, you are a poor doctor and going away. So hence, we need to show them immediate results. There is some false advertising and misinformation going on as well. We are competing with people who are advertising unethically. They're promising instant, perfect skin. They're promising never having to come back for pigmentation again. And therefore, we face a challenge of trying to educate them as doctors that this cannot happen, and you have to commit to a treatment regime. Many of my patients had previous bad experiences. They've gone to other doctors, no results. The pigmentation got worse. And then they have friends who had done the laser, the pigmentation got worse. So when they come in, they're often very guarded, and then they say, hey, you're trying to cheat my money. I don't believe you. I don't believe that you can treat. So I feel that in my clinical experience and in Singapore's context, it's very important to deliver good results on the first time, to give them a good result, and then they will come back. The moment you don't, they will go somewhere else, or they will just, they won't want to come back. So with fractional laser resurfacing, there are a few modalities. In the past, Fraxel laser, the first one, was the erbium glass modality. So this is a non-ablative fractional resurfacing. It goes very deep, causes a significant amount of heat. So I've used the Fraxel a lot, and it was very, very painful. And so after a while, the patients cannot take pain. With the evolution of aesthetics, there's also a problem. In the past, people could take pain and downtime, but nowadays they cannot take pain and they cannot take downtime. So later on, we moved on to the carbon dioxide fractional resurfacing. So that gave fantastic results with texture. At the beginning, people could take the downtime, but these days, you ask 10 people, 8 people are going to tell you, I cannot take CO2 fractional laser downtime. So this is just an evolution of expectations. And so the thulium laser is a very, very special modality. It's considered a fractional ablative modality, but it is much milder. It creates vacuoles in the skin, and so it allows penetration of products as well as resurfacing. At the same time, it gives you the benefits of ablative fractional resurfacing, maybe not so strong, but it gives minimal downtime and it improves pigmentation. So people ask me why I bought the LASEMD, why I chose to buy the LASEMD. I have to be very honest, I was very, very attracted by how it looked. So last year I went to Siew Lutronic Corporation and I saw this machine and I said, I have to buy the machine because it's so beautiful. Of course I was considering a thulium laser, I was considering other lasers. There's a very popular BB laser now in Korea. I was considering the clear and brilliant Premier as well. Eventually, I decided that the LASEMD was a good system because it gave very variable settings. There's an easy mode and an advanced mode. With the easy mode, there's preset settings at 3 watts, 4 watts, 5 watts, at 1 and 2 millijoules to allow penetration of products. You have an advanced mode where you get to control the settings from 1 to 20 watts, 1 to 5 watts, and 1 to 20 millijoules. So this allows you to control the depth of penetration as well as the width of penetration. So I will explain in a while about what settings I use and how I vary and how my settings have evolved. So the LASEMD comes with this also very sexy ampules. There are 6 different ampules that you can choose from. They all contain different ingredients. You can choose from one that's the vitamin C, vitamin A, tranexamic acid, resveratrol, human cord blood, conditioned media, and also the CK, which we use more for hair. In a lot of doctors' practice as well as my practice, I use the VC the most, the vitamin C, because the vitamin C gives you a lot of benefits, as we all know. I use the CK mainly for hair, like what Dr. Cho mentioned. So with the LASEMD, I find that it gives 2 actions. The first is that it improves the delivery of cosmeceutical actives. So it improves the delivery of the ampules that are designed for the LASEMD. Not only that, you can use your own. Am I supposed to say that? You can use your own ingredients as well. It improves the delivery of those ingredients as well. The second thing is that it gives a gentle fractional resurfacing to improve pigmentation, texture, and anti-aging effects. It gives the skin a brightening. So the thulium laser in Korea, I know it's been described as a BB laser because they say that after you do the thulium laser, it looks like your skin has BB cream on. So this is what I see in my patients as well. After they do it, they like that kind of very matte effect on the face. They find that the skin is glowing and then there is improvement in pores. This is the kind of downtime we expect from the LASEMD resurfacing. In this lady, I use level 1. This is a lady of Middle Eastern ethnic descent. So you can see that after the laser, she has some redness. This redness lasted only for 2 hours. Usually after the laser, I do a mask. And once she comes out of the mask, the redness is decreased by at least 50%. So it's a very, very bearable kind of downtime per se. And after that, sometimes they feel a bit of sandpapering of the skin. This is at the setting of 5 watts and 20 millijoules. So this is the higher setting. And this is the kind of crusting that you see. It's very different from CO2, whereby it is a regular pattern. So when it's a regular pattern, you cannot tell your colleagues that you had a suntan. But when it's this kind of pattern, you can cook up some funny excuse to say that you didn't you didn't go for a treatment, and a lot of ladies like that. So this is at 3 watts and 10 millijoules. So my nurses say that after that, I still look very handsome. So still can go out, still can meet clients. This is immediately after, and you get a bit of a rough paper, sandpaper kind of rough feeling for about 3 days or so. So I'll just show some clinical cases in my practice. Over the past year, I did 78 cases of 78 patients of LASEMD, and I've seen some with improvements, some without improvements, some with monotherapy, some with combined therapy. I would say that most of the patients are happy with the results. A lot of my patients, when they come, they have already done a lot of lasers. A lot of them are my old patients who did few years of lasers with me, and they plateaued. So we did a lot of laser toning with the Q-switch Nd:YAG. We did a lot of erbium glass fractional resurfacing, and it doesn't improve anymore. And they came to me and asking whether there's anything new to treat them. So this lady here, she had 3 sessions of LASEMD with the settings of 1 to 2 watts, 5 millijoules, TA serum, tranexamic acid. So you can see improvements in the texture and the redness. So the problem with this lady was that she had the red component that I didn't address previously, and with the LASEMD TA, it improved that significantly. This is another patient who had never had any treatment done. She had some dyschromia on the skin mixed with some melasma. So after 2 sessions, she wanted to try the RS serum, which is the Revesterol. She could see improvements in the color tone, in the pigmentation as well. And after 5 sessions, the pigmentation continued to increase, as you can see. So a closer look at the side of the face. So improvements as well in the skin tone and also in the pigmentation. And after 5 sessions, the skin tone maintained, and then there's also further improvement in the melasma. Same patient on the other side. So you can see improvements in the melasma after 5 sessions of LASEMD treatment at level 2, easy mode, and RS serum. So LASEMD works for melasma. It also works for PIH. So I find that it's very, very useful for PIH. This gentleman he's a good friend of mine. So he has a problem with having to put on a lot of makeup for his work, and he goes into the sun a lot, and he has a habit of picking at his scars. So this is just after 1 session of LASEMD with VC serum. 5 watts, 15 millijoules. So just after 1 session, we could see significant improvements. I didn't continue using the rest of the pictures because he picked again, and then it got worse after that. So this was the lady. So she had no real problems on the skin. She just wanted some skin refinement. And after 5 sessions of using VC serum at level 2, you can see that there's some improvements in the scars, and there's just general, a better glow in the skin, some improvements in the skin texture. Another case of recalcitrant melasma, also treated many years at another clinic, and then plateaued, not very happy with the old doctor, so came to me. Just after 2 sessions of LASEMD, you can see improvements in, again, the texture and also in the melasma. So this is very important in Asian patients, in Singaporean patients. If they come to you and then you treat once and there's no results, they're going to jump to another doctor. So it's very important that even after 1 session, they see some improvement. So with the LASEMD, I'm very happy to say that even after 1 session, they do see some results, and they do come back, and then they continue. But the big problem, as with all these patients you've seen, is that they cannot keep to the treatment schedule. So all these patients, the treatments, the results do continue to improve. The same lady on the other side. So after 2 sessions with TA serum at level 2, there's improvements in the melasma. So the LASEMD is great off the body as well. This lady was going to have her wedding. She's an Indian lady, so very difficult to treat in terms of using lasers. You can't go too high. She was having a wedding, but she has severe acne on her back, which was clearing. And this was with VC serum, 4 sessions of LASEMD, and at the settings of 4 watts and 15 millijoules. So I hit it a bit harder to try to get the PIH going off. So another lady with So besides using LASEMD by itself, I combine LASEMD with the other platforms as well, especially the Spectra XT. So I use either the Spectra XT laser toning mode or the Q-switch mode at about 2 to 2.4 joules, or the Ruby Touch. The Ruby Touch at 0.8 to 0.9. So this lady on lentigines there, I used the Ruby Improve. And then we continued the improvements with more LASEMD, and she saw improvements not only in the pigmentation but in the texture as well. This case, another lady, good friend of mine, 3 sessions of Ruby. I used the Spectra at 2 joules and also the LASEMD. So at the LASEMD, I use mainly to improve the dyschromia and improve the texture. I use this mainly for resurfacing, so I use a higher setting at 5 watts and 15 millijoules. After 5 times, you can see marked improvement in the dyschromia and also the texture. Same lady on the other side. I've treated her for many, many years, and I couldn't get rid of the pigmentation. So when I switched to the new platforms, Spectra and LASEMD, I saw that she continued to improve. Another case where I use the Ruby, Spectra, and also the LASEMD, and improvements in the pigmentation. Same patient on the other side. So improvements in the lentigines and the color, the tone, and also the general dyschromia. So I mainly use the Ruby for the lentigines, and then I use the LASEMD for generalized dyschromia and brightening, and it works very, very well together. And patients are very happy. This is another case, also had many sessions, didn't work. So she has been treated for years and didn't work, and I used the Ruby and LASEMD. A bit of improvement in the lentigines. On the other side, you can see a bit more improvement. So I always, when people always say that we as aesthetic doctors, we do not make a difference in people's lives, I always talk about this case. This lady, she has a depression problem because of her pigmentation. So when she came to me, she was very depressed, and she says she spends more than an hour every day putting on makeup because she's so depressed to go to work. And when she goes to work and she sweats, the makeup will run, and she's cakey, it runs. Her colleagues think she looks terrible. So one day her colleague dragged her to my clinic and asked her to come for treatment. She went to other doctors and they told her she cannot be treated. I don't understand why. But so this is after 4 sessions of Ruby, Spectra, and also LASEMD at higher dose, and you can see that she has improved significantly. So her mood really improved, and she tells me that now she puts on very little makeup, and she goes and faces the world, and she's much, much happier. The same lady on the side view. So in summary, sorry, not summary yet. So there are some side effects. I wouldn't say that I had no side effects with the LASEMD. I have had darkening of melasma with the LASEMD. This happened when I used settings that were too high. So at the beginning, I was too overzealous because I was so used to the Premier. The Premier is set at 1 watt and 5 millijoules. It is a fixed setting, and so I kept thinking that if I use less watts and higher power, I can get better results with melasma, but that was entirely the opposite. So when I used energy that was too high, the melasma actually darkened. And in a few cases at the beginning, I had darkening when I used too high power. There were allergic reactions. I had 3 cases whereby the patients had a reaction to the vitamin C serum. So after they put on the serum, they went back and they developed rashes. One of them had a rash to the laser, but not only the LASEMD, it was to every laser that we tried. With the VC, the vitamin C serum, these patients had on further questioning, they have had prior reactions to vitamin C as well. So this is not specific to the LASEMD serum, but the fact that they have a reaction to vitamin C. So this is one case where the melasma actually darkened. After 4 sessions, I used 2 watts and I think too high a power, so 8 millijoules, and melasma darkened a bit. This is another case where at the beginning I used Ruby to burn off a bit of the lentigines. It worked quite well. Then I became a bit overzealous, and then I continued with the high power, and the melasma actually darkened. So this is the latest picture, and I'm in the process of treating the darkened melasma right now. So in summary, with the LASEMD, the evolutions of settings, I was using higher energy, and I was using the advanced mode more. but now I'm using a combination of the easy mode and the advanced mode. Unfortunately, when you put something like advanced mode, we as egoistic doctors like to use advanced rather than easy, and that created problems for ourselves. So with, right now, how I usually use the LASEMD is I use the easy mode on the whole face, and on certain areas with problems, textural problems like the medial cheeks, and making sure there's no melasma, I use a higher energy setting to improve the texture. So the LASEMD is great as monotherapy. With monotherapy, we see improvements in skin tone, texture, pigmentation, including melasma, oil production, and fine lines. And you can combine the LASEMD with other lasers, such as the Spectra ST, the dual yellow, the erbium glass fractional laser as well. So this is the end of my talk. Thank you very much.
Okay, maybe we can take one or two questions from the floor, but then we are running a bit behind schedule, so we are going to proceed on with the next topic. So is there a question or two, or should we proceed on first? We'll have a lot more Q&A when we put the panel of doctors onto the on the podium in a while as well. Okay, any questions? You can raise your hands and the mic will come over. Okay.
Hello, hi. Thank you for the interesting talk. Just a question, because you mentioned thulium laser, one of the advantages is to increase or improve the absorption of the solution that you put on it. What is the advantage of thulium laser compared to conventional microneedling techniques, which also creates the particular channel through the epidermis? And whether the same result from thulium laser is producible by using a low, very, very low energy other fractional laser, for example, CO2 laser.
When we use microneedling or the CO2 fractional laser, we can observe that just microneedling also results in an immediate closing of the channel, or the oozing or bleeding can regurgitate the solutions that we would like to insert. But by the thulium laser usage, the pain is less. We can add more sessions to the patients, and the excessive heat damage is small. So unexpected scarring risk is much lower. And by making distinctive coagulation areas on the epidermis and dermis, we believe that other investigations can support that results is that coagulation can, like a sponge that observe the solutions that would like to insert into the dermis, and then that can slowly release to the skin. So we believe that by the non-excessive repetitive delivery of thulium laser to the skin, also effective to the rejuvenation or some kind of growth factor release to the skin, and by making non-oozing, non-bleeding channels to the skin and observing some solutions into this sponge-like coagulation on the scalp skin or on the facial skin can result in a long-lasting therapeutic effect to the skin for the rejuvenation or skin brightening, I think.
Okay, is there another question or no? Okay, then I'd like to thank the two doctors. I'm on the next trial for LASEMD to turn all my white hair to black.